Since the end of the post-election crisis of 2010, Côte d'Ivoire has known a period of relative stability. However, the crisis has had heavy consequences on the health system that can still be felt. Adams is a coffee plantation owner and lives in the West, a region that was hardly hit by the crisis. He came back after fleeing his village only to recover half of his fields. Today, Adams earns 5 times less than before the crisis and cannot provide for the health care of his family any longer.
The population is generally poor, and we were disorganized during the crisis. Thank God, since the end of the hostilities, the population has resumed its activities. We are in the village, we have returned to the field, and we are working the land to have resources.
To help Ivorians like Adams and his family, the government of Côte d'Ivoire stepped up to ease the access to health care. In the end of 2012, they decided to allow pregnant women and children under 5 to benefit from free health care. But in this fight for the recovery of the health system, Côte d'Ivoire is not alone.
Nous avons reçu des appuis en renforcement de capacité.
We received support to strengthen our capacity to treat mothers and children. We received equipment and supplies, and also several health facilities were rehabilitated. The support from our partners was extremely beneficial to us.
Cet accompagnement de nos partenaires nous est extrêmement profitable.
The ECHO project, financed by the European Commission and implemented by UNICEF and 4 partner NGOs, aims at supplying essential medication to the health districts that were hit the most by the crisis. UNICEF will be shipping 1,200 tons of medication worth 6.5 million euros.
This project has allowed the government of Côte d'Ivoire and its partners to take the time to restore the supply chain for essential drugs without impacting too much on the health facilities. More importantly, it is truly a partnership between the government, UNICEF, the European Commission, and NGOs.
So far, the project has allowed the supplying of around 250 health centers and 18 hospitals. More than 1 million women and children under 5 will receive free health care.
It's important to keep in mind that this is a pilot project. We are experimenting at an operational level with the implementation of a free target healthcare policy. One question that remains is the funding, and to which extent the government will be able to support the costs of such a policy. Another question is how we will be able to transfer the project to the governments, since neither ECHO nor UNICEF nor the NGOs are designed to stay for very long.
The final ambition of this project is to help the government rebuild the healthcare system and help reduce children and maternal mortality. This is Edward Bailey reporting for UNICEF Television. For more information, go to unicef.org.